Hey everyone, it's Michael here at Home Health Success Academy and 10xpatientreferrals.com. What you're going to be watching here is an excerpt coming from our webinar on how we actually taught a lot of our current members at 10xpatientreferrals.com how to be able to take advantage of the current COVID-19 epidemic and how to be able to double or even triple your referrals by taking advantage of the current state that's happening right now. So just to let you guys know, you're going to be watching an excerpt coming from that 2.5-hour webinar that we actually created. But at the very same time, if you enjoyed this quick excerpt, you're going to be able to actually watch the full webinar. All you have to do is click the link down below. And at the very same time as watch the webinar all the way through, because it's going to be on for a very limited time, then we just pull it out. But we're going to be offering you guys a lot of additional bonuses that you should take advantage of now. So enjoy the video and make sure you click the link down below after you watch this video. Now I'm going to share with you guys, some numbers that we got in regards to sales, okay? This is pretty much research that was done just on basic part of sales and marketing, okay? It's not just in the home health industry, but it pretty much applies to anything about sales and marketing. They literally say that 97% of agencies never even contact all sources of referrals. Meaning, let's say there's 100 nursing homes, for example, that you should be marketing to in your surrounding area that you provide services to. More than likely, right, 97% of agencies have not contacted at least one time every single one of those nursing homes. 97% of you guys have not contacted every single potential doctors that should be referring to you guys. Now here's an additional statistics, right? 48% of you guys, 48% of salespeople never follow up with a prospect. Never follow up. Meaning that if you visit them once, you never even follow up a second time, right? You didn't make a phone call, you didn't make a second visit, or if you did visit, you visited 6 months later, which does not even count no more. 25% of salespeople, make a second contact and they stop. So let's say you do follow up, more likely you don't come back in the third time. 12% of salespeople only make 3 contacts and then they stop. So just imagine that. If you're willing to do 4 or more contacts, you already beat what? 88% of your competition. So what we teach people in our whole training, right? So we have 10xpatientreferrals.com, which is our online learning platform. We show you guys everything on how you need to present yourself, how you need to be able to follow up, what you need to be giving, what are the mistakes that you might face so that you can avoid it and know how the techniques to get past those things. These are things that we teach you guys. Follow up is probably one of the most important things, and that's why we share with you guys, right? We call, we visit, we email, we text. And we do this on a weekly basis. We send something by mail. We send something by fax, right? We contact you in LinkedIn, contact you in Facebook. If you have Instagram, we'll hit you up there. We'll actually do the legwork for us. It's about making sure that you're doing your research. It's not that hard. A lot of people don't want to do the initial research, the prospecting part, because they think it's hard. But that really is the most important thing. If you miss a step on the whole sales process, that right there, my friend, is going to cause problems for you guys. The best marketing is to be able to have, a strategy in place, right? Let me ask you guys, how many times have you followed up your referral sources? Have you followed up your referral sources at least twice in less than a month? That's a question to ask yourself. If not, the reason why people don't follow up the next time is to say, well, the presentation didn't do well. It looks like they're already referred to another agency. I don't want to go there. Well, guess what, guys? Most people that you're trying to target, right, that is not referring to you guys yet, is using another agency. Your job is to be able to provide value to show them that they should actually use your services, right? So you need to come up with ideas on how to make your company stand out. We showed you guys the mask. We showed you guys what we did with the N95 mask. We showed you guys with our custom masks that we're giving out. The toilet paper technique that we're doing. It was getting people's attention. Remember, people must first know you, like you, and trust you, okay? So the reason why you're not getting referrals from certain places is they just don't know you. And just because you visit them once, that does not mean that they already know you, right? You need to transition them from knowing you, knowing who you are, getting their attention. Now you know who I am. Let me keep on bugging you a little bit so that you can keep on making sure that when you see me, when you hear me, you know about my company. Then I need you to be able to respect me and like me. And then I need you to eventually trust me by me providing value to you so that you want to work with me and refer your patients to me and trust me enough to provide care for your patients being discharged or your loved ones, your family members. That is the main goal that we all need to be able to make sure as a company. Remember, sell last, educate first, okay? So be able to make sure that you have a follow-up system in place. And we want to be able to share with you guys the follow-up system. So once again, that's something that we're going to be giving you guys is our whole follow-up system. That's a bonus we're going to be giving you guys towards the end of this. So make sure you pay attention. So make sure you have a great follow-up system. If you don't, that's why we're here. That's why we're sharing with you guys some amazing information. So now moving on to what else can make you stand out. So here's one thing, right? So I have something in my hand right now. I'm pressing it right now. So it's gonna take a few seconds and I wanna be able to share that with you guys. So this is one thing that actually gets us. So as you guys can hear, what this one